Hello, my name is Nicole Houser. I am the Executive Director of the Community Free Clinic in Hagerstown, Maryland. Our mission is to make healthcare accessible to all uninsured residents of Washington County, Maryland. Our clinic sees, again, and this has been for over 30 years, we have seen the uninsured of Washington County, Maryland. So that includes residents who are working full-time but cannot afford to pay for the health insurance that is offered to them. It also includes many residents who are working 2 and 3 part-time jobs and are not offered health insurance. So by receiving this funds, that helps with our several of our programs, one being our disease management program, which has the highest population of diabetics. We also have our second highest would be COPD, and then high blood pressure, and kind of several things that go along with being a diabetic. We also have for about a year and a half now, we have had a mental health program. And as you could imagine, through COVID and the pandemic, and a lot of people not being able to leave their homes, losing their jobs, or just whatever, losing family, having family who were sick with COVID, the mental health numbers have increased exponentially. So this funding will help in the sense of continuing our programs and helping those who need it the most. Washington County, Maryland is made up of 9 towns or 9 jurisdictions, with the city of Hagerstown being the seat in the center of the county. We have several outlying counties that we have patients who struggle getting here, and we have actually worked with some other organizations to make sure they have the transportation they need to get to our location, and that is who we see. Without us, our hospital, which is Meritus Health System, would see a lot more of patients with these problems, letting them go to a point where they end up in their emergency room, and then ultimately end up becoming a patient for however many days to get them back to where they can function properly. So we're taking that burden off of the local hospital here by treating the patients, making sure they get their medications, making sure they're being seen monthly, and it can make sure that all their numbers and all their lab tests and everything are showing positive numbers and are decreasing as they should be. With the mental health piece, we can follow along. Some of our patients are seen weekly, some every other week, depending on the need and the reason they're being seen. But we can ultimately, in the mental health program, work that patient so that they aren't relying on us anymore. And I would just like to say thank you very much to your foundation for this funding. This past year has, again, with the pandemic and so many other nonprofits, I'm sure, are all dealing with the same thing, and that's a loss of funding from our fundraisers that we normally can have. So this money has been a blessing and is truly appreciated by all staff, all board members, and all of our patients. So thank you.